Keep your head in the game. Concussion is defined as a temporary unconsciousness caused by a blow to the head. This definition leads us into one of the most extreme results of a head trauma. Oftentimes, the collision can cause momentary feelings of unease or pain and dizziness, but seem to disappear after a few minutes. Concussions in kids ages 8 to 13 years old has doubled, and concussions have risen 200% among teens ages 14 to 19 in the last decade. While concussions affects all ages, adolescents are at a higher risk because of their developing brains. More specifically, women are exceedingly more susceptible to concussions than men, where a high percentage of concussions in women are seen in female soccer players. Soccer is the second leading sport to cause the most concussions in females. Out of every 10,000 athletes participating in soccer, there are 4.5 concussions among girls and 2.8 among guys, but those numbers are steadily rising due to the increased popularity of the sport. The daily routine developed in a player's life is disrupted by the lack of judgment and control, as well as impaired eyesight noticed in the affected athletes. This leads to a struggle to complete a simple task or cause one to seem unlike themselves. With the nickname of invisible injury, the severity of a concussion can be dismissed and overlooked because the trauma to the athlete's brain is not easily noticeable. Quite often, a player is sent back into the game before the brain has fully recovered from the injury, putting the athlete in a position to expand the damage and pull out stronger visual symptoms. After a blow to the head, one might experience vomiting, dizziness, impaired balance, vision problem, and might possibly appear dazed. While the short-term effects of a sports-related concussion are unpleasant and frightening, it is the long-term effects that causes most of the concern. Depending on the severity of the injury and the number of times trauma has occurred, the athlete can develop motion-impairing diseases such as Parkinson's disease or anxiety disorder. While mild concussions are often difficult to detect in the moment, there are many signs to look for in the event of a blow to the head. Unconsciousness, abnormal breathing, bleeding or clear fluid draining from the eyes, nose, or mouth, disturbance of speech or vision, unequal pupil size, weakness or paralysis, and neck pains. Children or teens will continue to play and endure a repeated hit that causes the brain to swell, leading to mental problems. Approximately 500,000 children a year visit the emergency room for traumatic brain injuries, where the good majority of the trauma is caused by a sport of some kind. Even though the physical effects tend to ease off within an hour or two, they can leave behind a lasting impression on one's brain and cause serious or fatal issues. Soccer relates to numerous injuries in student athletes during this generation, and while they may not all be severe enough for a hospital visit, concussions are a growing problem and leading cause for mental and physical troubles faced by the players.